Oh, hey, how are you? Dan Marin here at Proform MD. Thanks for being here today. This is one of our ultrasound machines that we use to help diagnose patients here in the clinic. And when we started making our clinic, we wanted to have one-stop shop so that we could help diagnose a patient, treat them, and have them seen in an effective manner as quickly as possible. And so as a result, we tried to get a facility that would help us with that. So I'll give you a little tour here as we're walking. One of the things that we wanted to include when we had our facility was having a gym that you can see over here. So an important portion of rehab is obviously getting stronger. What we also found was that getting stronger has to happen at the right time. And if you know rehab, you need to first see a patient after an injury, and you need to calm down their inflammation, and then you need to try to get their range back, and then you eventually can start working on getting stronger. Oftentimes we get patients that have been going to particular therapy places and they've been trying to work them out for 3 months, and they keep hitting their head up against the wall and having a lot of frustration and pains as a result. So as a result, you need to have a team and a location to support it where you can address that first phase, which is getting a patient out of pain, addressing inflammation, and then getting the range back and eventual strengthening. So as a result, we've got our own therapy gym. We've got Ozzy Perez, who's a manual therapist and physical therapist, long history of treating spine and sport patients combined. That's part of our goal. And as you can see, we're in close proximity, so when we have any type of issue that comes up as a hiccup in a rehab course, we're addressing it very quickly, but more so getting patients into therapy and monitoring their progress through therapy can be done here like in no other place. And so that's why here at Proform MD, we are very attentive to our patients' biomechanical process and how they come in and then how they progress and where they end up. And we end up seemingly having quicker results through our rehab course. We find that very appreciated by our patients and makes going to work every day a nice feature.
The key to physical therapy I have found in my many years of practice, like Dr. Marin said, is to calm the patient down. You come to see me with pain, I have to get rid of that pain. I have to calm down those symptoms. If you don't do that, you're not going to get better. It doesn't really matter how strong you are or how flexible you are. The first mode of treatment is to calm it down. The great thing that I found about this place, well, there's a lot of great things, but the main thing when it comes to rehabilitation is that we're a team here, and it's a team approach. If you get sent to physical therapy and you're not getting better in 3 or 4 or 5 treatments, you got the physician here that I can go to and talk and discuss your case, and maybe, send you back to the physician. Maybe he can do something to get you better and then return you back to therapy so that your progression is quicker and we can get you back to your activity quicker. We can get you back doing the things you like quicker and get you out of pain quicker. It's an optimum place if your objective is to get better, if your objective is to get better quicker and get back to the things you like to do.